Here's a critical factor that's being completely overlooked in discussions about post-pandemic cancer diagnoses. The pandemic massively disrupted cancer screening and detection, creating a backlog that's now emerging right as vaccination campaigns rolled out. The timing creates perfect conditions for false causal attribution, but the actual relationship is coincidental, not causal. Let's walk through what happened. When COVID hit in 2020, healthcare systems essentially shut down all non-urgent services. Routine cancer screenings, mammograms, colonoscopies, dermatology checks, prostate exams were postponed indefinitely. People who had concerning symptoms often avoided seeking care out of fear of COVID exposure in medical settings. Resources were diverted to pandemic response. This continued for months in many areas, over a year in some places. During this screening gap, cancers didn't stop developing. Tumors that would normally have been caught at early, highly treatable stages continued growing, undetected. People who would have gotten routine screenings in 2020 didn't. Symptoms that would normally prompt a doctor's visit were ignored or managed at home. Then, as healthcare services gradually resumed in 2021 and 2022, exactly when vaccination campaigns were ramping up, all of that delayed care came flooding back. The screening backlog meant massive numbers of diagnostic procedures happening simultaneously. And inevitably, many cancers were detected, often at more advanced stages than they would have been if caught during routine screening at their earlier phases. This is a textbook example of detection bias or surveillance bias. The underlying cancer incidence, the rate at which new cancers actually develop, didn't change. What changed was the detection rate. It's like saying crime increased because you hired more police officers. The crimes were happening already, you're just finding more of them now. Additionally, COVID-related medical imaging created incidental findings. People getting chest CT scans for COVID pneumonia had existing lung nodules detected. The increased health anxiety following the pandemic led people to investigate minor symptoms they would have previously ignored. The worried well sought medical reassurance and underwent testing that revealed coincidental abnormalities. This is also an illustration of lead time bias, a statistical illusion where diagnosing disease earlier makes it seem more frequent when actually the underlying rate hasn't changed, just the timing of detection. The tragedy here is real, but it's not about vaccines causing cancer. It's about healthcare disruption during the pandemic leading to delayed diagnoses, resulting in some cancers being caught at later, less treatable stages. Some patients who could have been successfully treated if their cancer had been caught early in 2020 instead had advanced disease by the time it was finally diagnosed in 2022. But because vaccination campaigns coincided temporally with the resumption of screening and the diagnostic surge from the backlog, vaccines became a scapegoat. People looking at cancer diagnosis trends see an increase starting in 2021 to 2022 and note it corresponds with vaccination timing. What they're missing is the confounding variable of resumed screening after massive disruption. The epidemiological evidence is clear when you control for screening rates and look at stage at diagnosis. What we're seeing is characteristic of detection bias from screening disruption, not new disease emergence. Blaming vaccines for this diverts attention from the actual cause, pandemic-related healthcare disruption, and prevents us from learning the crucial lesson about maintaining screening continuity during future public health emergencies.